And now I'm also going to start the PowerPoints deck. And then again, what I'd like to be able to do is go through all 19 slides. If you can hold your questions till the end, I'd appreciate that. And then we can respond to those questions and get feedback from the group to make sure that we're not missing anything or forget anything. Does that sound okay, folks? Okay. So we're going to share the screen here. Can everybody see the screen?
Yes.
Yep. Okay. All right. Well, again, thank you for joining us today. I also wanted to thank many of our faculty and staff who participated in the preparation of this plan. We invited members of the President's Cabinet to participate and provide feedback and input. And we also formed an ad hoc task force of 12 faculty and staff who have contributed to the development of this plan. So I want to thank them for their meaningful contributions and assistance. So we're going to go through this in phases. What I mean by that, our back to campus plan is going to have 3 phases. And you might ask, well, why are we doing this phasing? Well, on April 16th, the White House released guidelines for opening up America again. It was a document that had 3 phases in it, with each of the 3 phases having different allowances for social gathering and for which businesses would open up and that sort of thing. On April 23rd, Governor Cooper announced similar plans to have 3 phases of lifting restrictions here in the state of North Carolina. Here in Cabarrus County, where the college is located, the Cabarrus Health Alliance is developing a Cabarrus County COVID scorecard. And this scorecard will have specific gating criteria that are consistent with the federal and state guidelines. And it's really focused on public health metrics, things like how many recent cases of COVID-19 we have, what's the capacity in the hospital to take more patients, and those sorts of metrics. So our back to campus plan is going to have 3 phases, and it's going to be congruent with both the White House and the state of North Carolina guidelines. And that way, as the state and the county changes the public health phases from phase 1 to phase 2 to phase 3, we will change ours accordingly. So as we finalize this plan, we will distribute copies of the plan to students and teammates, and we'll post signs around campus with which activities are permissible and which ones are not during each phase. The overarching principle is that we want to make sure we have COVID safe standards. In particular, we want to maintain a COVID safe educational environment where we're going to have 3 key requirements. That is screening of people who enter the building, both students and teammates, universal masking, where everyone would be required to wear a mask, and then social distancing of all students and teammates. We also, in our COVID safe standards, are going to prepare for rapid testing and results at Atrium Health Cabarrus Hospital for students and teammates who meet the COVID testing criteria. So if an individual comes to campus, gets screened and has a fever of 102 degrees, we will be able to send that individual over the hospital for rapid testing. We want to make sure our facility is dedicated exclusively for non-COVID students and teammates. Meanwhile, we want to be able to have a virtual online campus for students and teammates who have tested COVID positive. Also for those folks who are at high risk or who have dependents who are at high risk. We also want to make sure that we continue to lead other institutions with the delivery of exemplary healthcare education. Even during a global pandemic, we don't want to let down on the quality of the education that our students are receiving. So again, those some other safety requirements. We talked about screening. We're going to partner with our colleagues at the hospital. The screening at this point will actually be conducted by hospital employees in our building. Again, we're going to have testing available at the hospital for all teammates and students who who screen into COVID testing. And we're also partnering with the Cabarrus Health Alliance for contact tracing. So in the event that someone is tested positive for COVID, we want to make sure we put them in touch with the Cabarrus Health Alliance so we can track the contacts with whom those individuals come in touch with. Here's an outline of our screening procedure, and here's what we're envisioning at this time. We're envisioning that students and teammates would line up at the courtyard or the pavilion entrance, and they would stand on tape marks that are 6 feet apart for appropriate social distancing. This is similar to what you might be experiencing at local retail stores if your family goes to Walmart or to Home Depot or anything like that. There's these 6-inch or 6-foot spacing available. We would require masks of all people before proceeding through screening, and individuals who might be coming from a clinical experience or students who might be coming from work at the hospital that are wearing dirty scrubs would be prohibited for entering. We don't want to have soiled scrubs that might increase the likelihood of transmission, so we're going to keep an eye on that. We would have entrants enter the pavilion and go through a series of tables. So one table might be for students and teammates to clean their smartphones. One might be a hygiene table where there'd be some Germex or some solvent to clean one's hands. And then the screening table where participants would respond to 4 or 5 verbal questions and then have their temperature taken. After students and teammates go through the screening process, it's likely they would be given a wristband, where the hospital has different colored wristbands every day. And then after students receive their wristband, they would enter out of the pavilion and into the foyer, into the main hallway, right there in front of Beth's desk. And they would be checked to make sure they have the appropriate wristband for the day before entrants are able to proceed into the designated area, whether they're going to an office or a class or a lab. So that's what we envision at this point for the screening procedure. Another important component of social distancing and safety is traffic flow. We envision having a traffic flow indicated with the use of signage, either on the floor or on the wall or both. We also think it's wise to dictate the traffic flow, where we might have everyone enter up the elevators or potentially up one of the stairwells that would be designated to go up. We would likely designate that only 2 people would be allowed in the elevator at a time. That way we can ensure we have 6-foot spacing within the elevator. We might encourage folks to exit through one stairwell or both stairwells. And then the hallway traffic would likely be managed by creating either a one-way traffic pattern throughout the 1st, 2nd, and 3rd floor, or just like when you drive your car, it might be right side of the hallway only. So we're still working out some details about how exactly we want the traffic flow to work, but we would definitely have some designated traffic flow outlined for everyone that's in the building. Now I'd like to identify the different learning activities that would happen during these 3 phases. Again, these phases would be dictated by the local public health authority to make sure that Cabarrus County is ready for folks to get back to school, get back to retail outlets, and so on. In phase 1, we would not have any in-person lectures, and we would continue to have lectures that are either synchronous in real time online or recorded lectures like many of our faculty are doing now with voiceovers over PowerPoints or recording their lectures on Zoom. The federal guidelines for phase 1 dictate that we cannot have any more than 10 people at any one place in a given area. So we would start off with our labs to have less than 10 people when it's essential to have labs. In some cases, simulations might be appropriate, and in those cases, we would use simulations. With respect to our clinicals, we would get back into our clinical setting as soon as possible. We think that's really important for our students to get hands-on experience working with patients, and we would do that as soon as our field work and preceptor facilities are ready to take us. When those preceptor facilities are not available, we would use simulations when we can't do that. With respect to safety during phase one, again, we would have screening, a symptom check at the entrance. We would have a limited number of personnel. We'll call it essential personnel only. So only the faculty that are required and needed for labs would be allowed on campus. We would have everyone else working from home. We would conduct our business like we normally have several meetings a day. We would conduct those online using Zoom or the Microsoft Teams product. The deans, that is our provost and dean of academic affairs, our dean of student affairs and enrollment management, and our dean of administrative and financial services would dictate which personnel are essential. So we would probably have a limited number of personnel. With respect to which rooms we would use within the building, obviously we would need to use our offices and our labs and the restrooms, but the phase one guidelines at the federal and state levels dictate that we can't use common areas. So the pavilion and classrooms that are not in use, the computer lab and group study areas would not be allowed during phase one in order for us to remain compliant with the federal and state guidelines. Masks would be required. It's uncertain at this time if we would be able to provide masks or if folks would have to provide their own. We are working with the hospital and our suppliers to see if we can acquire PPE. At this point, it's likely that folks will have to provide their own PPE, and we would provide videos on how to make your own cloth masks. During phase two, we would allow in-person lectures of up to 30 people. Now, the federal and state guidelines state that you can have up to 50 people, but in order for us to have proper social distancing within our classrooms, it's likely that we would have to limit it to less than or equal to 30 students in our classrooms. For those faculty that think it's still appropriate to provide online lectures or recorded lectures, they would be doing so. We would continue with our in-person labs of less than or equal to 10 students and provide simulations when possible. And again, our clinical facilities, we would get our students into clinicals and field work as soon as possible. Not a lot of changes with our safety at phase two. We would continue to do the screening at the front entrance. We would have a few more people on campus, so we would go from essential personnel to required personnel. Faculty that are teaching in the classroom and teaching in the labs would be available to come back to campus. But most of other folks would be working from home, and we would continue to have synchronous online meetings. So the rooms that we would use within the building include our offices, our labs, and our classrooms. Of course, the restrooms, but again, based on federal guidelines, we're not allowed to have folks in common areas until phase three. Just like phase one, we would require masks. Admittedly, with phase three, there's less certainty with the guidelines that are coming to us from Washington and from the state. So there's some more ambiguity here with what phase three might look like. But with phase three, we would envision that we would be able to continue the in-person lectures where appropriate and where faculty thought that was needed. But again, we would need to maintain the social distancing of 6 feet between folks, and that therefore probably have about a maximum of about 30 people in the classrooms. We would have synchronous and online and recorded lectures otherwise. We would still have our labs. We might be able to increase our capacity in our labs a little bit, but given the size of our labs, we might not be able to have many more than 10 people. And again, with the clinicals, we want to get students into clinicals as soon as possible, and the clinical situation would not change. Again, with safety, it's a little bit more uncertain with what the federal and state and local guidelines will be with safety at phase 3. We may be able to move to self-monitoring instead of screening at the front entrance. Masks might be able to go from being required to recommended. And we would probably be allowed to have more people on campus. So we would have all personnel potentially on campus, but we might do so in shifts where some people would come in the morning and other folks would come in the afternoon, and others would work from home. So in phase 3, we are allowed to have common areas with social distancing. So we could open up the pavilion, we could open up the C Street, I think it's called here, and be able to have computer labs and study group areas open during phase 3. Let me share with you a few more details. One is cleaning. We've been working closely with the organization, the cleaning company, and we've learned that their cleaner is Virex, which is one of the cleaners on the CDC list for killing COVID-19. The crew wears gloves and masks at all times. We have a day porter, so they come and clean in the evening, but they also have someone here during the day for 4 hours a day, and that person will wipe down the highly touched surfaces every hour. He or she will also wipe down the chairs and surfaces in between classes, and they will conduct deep cleaning. We'll get more detail on how frequently that deep cleaning will occur, whether it's daily or several times per week. And we've made arrangements for the cleaning crew to come back for a deep cleaning before we open the building back up. So they'll be ready to go for us when we arrive. We've done a lot of work on classroom capacity. We've looked at fire code capacity. We've measured, what it looks like for folks to be 6 feet apart. And of course, during stage 1, we would not have folks in the classroom, but in stage 2 and 3, we have these ranges. We have a work group of folks that are working on calculating exact capacities for each of our classrooms, so we know what is safe and what folks will be able to do. Similarly, in the lab, we have some capacities worked out for both stages 1 and 2 and 3. So we do have, capacities during regular times of 20 to 28 students, but in order to ensure social distancing, it will be smaller, in the range of 4 students on the low end to 8 students on the high end. Another one of our work groups is working on some of the other important components to reentry and transition. They're working on communication, some compassion, and some connection. So we're going to make sure that we have open, frequent, and consistent communication with everyone involved. We'll use different modes of communication. So we'll use email and video and communicate by print to the best of our ability. We're making sure that during this difficult time, folks have self-care in mind. We're working on a going home checklist. One of the recommendations that was made, that in the event that a student cannot participate in classes one semester, that we might consider waiving the CLOA fee. So if someone has to register or defer their enrollment in certain classes or programs for a semester, we're looking at the possibility of eliminating that fee. And of course, we need to make sure we have alternatives for at-risk individuals. If there's someone that is at high risk because they've got some underlying health conditions, we're going to have to do our best to use ADA compliance to make sure that folks have alternatives for their educational opportunities. Some of our teammates are also working on some ways to continue some of our student celebrations and teammate activities, and have ways for folks to connect with one another during these Feeling It Fridays. We're also going to provide additional resources on our website and to our students through hotlines, the Employee Assistance Program, and some resilience and well-being resources. My last slide is that we've got more work to be done. We've got our work group of 12 folks that are still working on these activities. We're getting more clarity on what this Cabarrus County COVID scorecard will look like and what the gating criteria will be. We're also getting a deeper understanding of contact tracing and how the Cabarrus Health Alliance will do that. We're finding out from the hospital and our providers, our supply chain, of the availability of PPE and whether or not we'll be able to provide that to our teammates and students. We're also getting more information on what it's going to look like for COVID testing, and then later the antibody testing. And we're finalizing the specific capacities for how many students will be allowed in our classrooms and labs. We're finalizing the traffic flow. We're getting more clarity on cleaning, and we're going to see if there's any adjustments that need to be made to the room and course scheduling. We're hoping to keep that to a minimum so that students can adhere to their course schedules without having to make any changes or modifications for childcare or work. And we're also making those modifications to lab section sizes. We're very sure we're going to have to reduce the number of participants in labs. We may need to change what some of our face-to-face courses look like as well. So that completes kind of the broad overview of what we're envisioning. And at this point, what I'd like to be able to do is, again, ask for some feedback. Ask you guys if there's some things that we may have not thought of or missed, or if you have any clarifying questions, or if there's anything that was unclear you'd like me to restate. You're welcome to either share your thoughts or feedback verbally, or if you'd prefer to type your question in the chat function, I'd be happy to respond to any questions that way as well. So students, what do you think? Sadua's got her hand up. Please go ahead.
Hi, sir. My name is Sandra. I'm in the nursing program. My question is, you spoke about phase 1. There's no class, but there will be clinicals. So I wanted to ask you if, in case students are put on the floor where they have the COVID patient, how are they going to be protected since?
So I think what Sandra's question was, when we go back to phase 1 and students are in clinicals, and what happens if they're in the presence of patients with COVID? Was that your question?
Yes, sir.
So in addition to us working out what our back to campus plan looks like for folks coming physically back to campus, we have another group of individuals where Dr. Patchett, our provost, is participating with what it's going to look like for our students when they go back to clinicals. It may be that students can, it might be that students can opt out for those situations where they're, especially if they're at risk or they have pre-existing medical conditions, they may be able to opt out of those clinical opportunities. Or it might be that others are not able to, and you'd have to make a decision of whether or not you want to participate in those clinicals. Dr. Patchett, you're involved as our representative with that work group. Is there anything else you'd like to add to that for Sandra?
I think the only other thing I would add is that we will try our best to avoid having you in contact with a known COVID positive patient. But there's always that risk that you might come into contact with someone who's asymptomatic. So again, we would do our best to keep you separate from COVID positive patients that we know are positive.
Great question, Sandra. Does anyone else have a question for us?
Thank you.
Yes, sir. Hi. My name is Laura Ferguson. Can you hear me?
Yes.
Hi. I'm in the Masters of OT program, where we come to campus every 3 weekends. And I'm wondering what the plan is for having us return to campus in consideration with the fact that we have people flying and driving in from all over the country, and we have to stay in hotels and things. So what is the plan for our program?
Yeah, thank you for that, Laura. The MOT program does present us with a different set of challenges because you do come on weekends, and some folks have to fly and make travel arrangements. And there's guidelines in place for interstate travel, where when someone travels from one state to another, they're supposed to be set aside for 14 days or self-quarantine for 14 days. And obviously that's not going to work for our Masters of Occupational Therapy program. We will make arrangements for screening. So when folks do come back to campus on the weekends, we will have screening available from hospital staff. And we will, so one other thing that's important to note is, so let's say the state of North Carolina lifts the stay-at-home orders on May 8th, which is what we're hearing is could happen, is that the state may lift the stay-at-home orders on the 8th of May, this Friday or Saturday. Well, just because the state goes to phase one and the local county may go to phase one, that doesn't mean that we're going to go to phase one that exact same day. So we might decide, okay, we're going to give our folks 2 weeks notice or a month notice before we go to phase one and open campus back up. So that would give folks time to make travel arrangements and give us time to make sure that we have all our supplies ready and that we're ready to go on campus. So to be frank and candid, we're still working out some of the details of how we're going to manage the MOT program. We recognize and understand that there's some unique challenges due to the travel and the weekend study. And we will have some answers for you for our next draft of this plan. But thank you for bringing that up, Laura. You bring up great points.
Okay, thank you very much.
Sure. Casey has a question that she's posed through chat. So let me read her question for you. It says, for summer classes that begin on Monday, May 11th, the classes and lab sessions will be delivered virtually, correct? That is correct. We are planning on starting the summer semester virtually. And in the event that we are able to go to phase one and be able to have face-to-face clinicals and face-to-face labs, we will let everybody know with advance notice so that folks can be able to come to campus. But yes, we're planning on summer school as planned. Our faculty have prepared different contingencies. So for each one of your classes, our faculty have prepared a plan for what happens if it's phase one. They've got a plan for what happens if it's phase two and a plan for phase three. So as a community, as the community of Cabarrus County and Concord and here at Cabarrus College, as we are prepared for folks to come back to social settings and see each other face to face, as we move through those phases, our faculty are prepared and ready to go with their plans for your instruction. Now, in some cases, some of our faculty are going to teach online didactic courses for both phases one and phase two. And they may not be ready to do face-to-face instruction until phase three, and that's okay. But each one of those phases is prepared and each faculty member has got a plan. Thanks for that question, Casey. Caitlin Judge has another question. She has a question in regards to classes and labs. Caitlin, what's your question?
Hi. So my question in regards to classes and labs, I'm so sorry, is that when it comes to the labs that we took last semester and paid for the fees that are associated with them, I did see that they're crediting us a very small portion towards the summer classes that we're taking. Will we still be expected to pay the lab fees and computer fees? And will us as students see any maybe tuition credit or account credit in regards to the fees we paid last semester but weren't able to utilize? Especially being someone that had to pay out of pocket after quarantine started to be able to put resources into my home for that.
Okay, well, thank you for that question. Caitlin's question is what about fees? So if you took classes in the spring semester that had labs and course and fees that were associated with that, and you had an incomplete, then you would be able to take those labs in the summer and you will not be charged a second time. You've already paid for those labs, you've paid for those clinical experiences, and because we were unable to provide those during the spring semester, those will be provided as soon as we possibly can, hopefully in the summer semester. So you won't be charged for those labs and clinicals. However, if you also have summer classes that require labs and clinicals, you would get charged the appropriate fees for that. We did look long and hard at these fees you're charged, and want to remind you that these fees that we charge, we had to make pretty big investments in technology to make sure we could shift from face-to-face to online learning. So we had to make more investments in tutoring, remote testing, Zoom licenses. We purchased a whole bunch of software for labs and for clinical simulations. So we did make a small adjustment to your summer activity fee to recognize that. But again, the college has made some big investments, and we feel like we've still provided you with a good education, regardless of the fact that we couldn't get you into labs and clinicals. Again, the important thing to note is if you paid for labs and clinicals in the spring semester, you're not going to have to pay for them again. You will get those as soon as they're available, hopefully during the summer. Does that make sense, Caitlin?
Yeah, it does. Thank you.
Sure. Also, let me put a plug in for CARES Act funding. Today is the 5th, and our student affairs team has been sending out information about the CARES Act funding that's available. So anyone who has been impacted, it's important that you complete that application and request funds, because we have a couple $100,000 we need to distribute to students who are in need. So please complete those applications by, I think it's the 7th, so that you can be considered for those funds. We have another question that has been posed through the chat. Casey is asking if there are lectures that have more than the capacity of the room which is held to follow distancing guidelines, such as room 2228, and has a capacity of 30. How would that work? Where would those additional students go? So thank you for that, Casey. We're envisioning a couple different scenarios, and again, the faculty are discussing these individually with the department chairs and with Provost Patchett. So a couple scenarios that are being considered. One is that for one scenario, we would do a hybrid model where faculty in those large classes would have an in-person class with up to 30 people and would broadcast synchronously in real time to the other students. So some students could be at home and they could watch the lecture. They could pose questions in chat, just like we're doing here. And we would have a second person in the classroom that would facilitate the asking of questions. So we would have someone that sits at the computer, and when a student at home asks a question, they would pose the question on behalf of the student. So that's one scenario we're looking at. Another scenario we're considering is the possibility of breaking up some of those very large classes into smaller ones, so that we could potentially have students on campus with sections of less than 30 students. Another pedagogical model I've heard people consider or discuss is the possibility of having large lectures online with lots of students, and then smaller recitation or smaller study groups where students could come in groups of 20 or 30 and review the content and have like a tutoring session almost with a faculty member or a supplemental instructor. So there's 2 or 3 different models that the faculty are looking at, and each one's going to have their own mode of delivery. But that's a great question, Casey. Thank you for that. Other questions that folks might have?
I just have a quick question, just going back to fees real quick. Has the campus looked at waiving the fees for setting up a payment plan, or waiving the $100 fee for being penalized for not paying your plan on time? I know a lot of us work in skilled nursing facilities and other places, and we are down to reduced hours, sometimes 3 hours a day, which puts a hardship on us.
Yes, Alexis, thanks for that question. We have talked about that, and what we're doing at this point is we're managing these on a case-by-case basis. So if you're experiencing financial hardship and you'd like special consideration for either payment plans or certain fees, then what you're encouraged to do is to contact our billing department, Rhonda Hill and Malia Barrett, and describe your challenges, and we will consider all of these things on a case-by-case basis. We have been very, very flexible with both payments and setting up payment plans and fees. So We understand the hardship that everyone is facing, and we will continue to provide maximum flexibility to help folks. Great question. Thank you, Alexis.
Thank you.
Okay. Other questions? Caitlin has a question. It looks like it's about healthcare insurance. I might need some help here from Dean Corsello or others, but I'll read the question and see if I can answer it. If we lost our healthcare insurance related to COVID-19 from loss of hours or income, what resources can the college offer students, seeing as having health insurance is required to be enrolled at the college? There's one company listed on the college website, and they're rather expensive. So in addition to resources available that we've listed on the college website, the Affordable Care Act provides opportunities for folks to get healthcare insurance. So you don't have to go to just the resource we've posted on our website. There are lots of providers through the ACA, the Affordable Care Act. But that's the extent of my knowledge. I'm going to turn it over to Dean Corsello to maybe she can help with any other information. Chris?
Hey everybody. I would actually have said the exact same thing. We do know that the vendor that we work with who provides insurance to us can be expensive for some. So we do encourage you to look at other options. Keep in mind, we have to have proof of insurance. You don't have to have the expansive coverage, but you do have to be able to be covered should you become ill or injured, particularly in a clinical or fieldwork setting. So keep that in mind. But I would encourage folks who find those options too expensive to look at the Affordable Care Act options. Those are probably your best ones.
Thanks, Dean Corsello. Caitlin has a follow-up question, which is closely related to another question posed by Carissa. So let me read Caitlin's follow-up question first. Caitlin said that they're estimating 30 or more days for coverage to be accepted through the government. What happens if we start classes next week? So I see the conundrum here, right? What happens if we start classes next week and my health insurance doesn't kick in for 30 days? Then what do I do? Well, in a case like that, we're not going to force anybody to go back to class or labs until that's resolved. So we're not going to ask anyone to put themselves at risk. And if that would happen to you, then you just need to notify your faculty members or maybe work through our student affairs staff so we can make accommodations for that. That's a good question. Similar question is what Carissa has posed. What is the plan to keep track of students who are at risk or also have dependents who are considered high risk? So we're not going to put folks in situations where they're not comfortable. And remember, at the beginning, I had suggested that we're going to have two different campuses, if you will. One campus would be face-to-face here in Concord for non-COVID folks. The other campus would be a virtual campus for folks who have tested positive for COVID, who are at high risk, or who have dependents that are at high risk. So you might be one of those individuals that has a pre-existing medical condition and you can't come to campus. So in that case, we would make sure that you are able to get your education delivered to you online. So with respect to keeping track of those, we will have to come up with some process whereby if you're one of those individuals that is at high risk or has dependents at high risk, that you would notify us that it's your intent to study online, and we will have to notify, either you would notify the faculty member or we would act on your behalf to notify faculty. Okay, next question from Magdalena. It says UNCC is planning to start classes in September. Or are you considering it for the fall semester? So again, the plan is to follow these phases 1, 2, and 3, that would be somewhat dictated by our public health authority. When our public health authority says it's safe for folks to go back to stores and restaurants and school, then we would be able to support that. We sure hope that we're able to be back in face-to-face classes, that is phase 2, by the fall. And if we are able to be back to campus and the community is in phase 2, we will come back. However, if the public health authority says that we're still in phase 1 or we're still at stay-at-home orders because our hospital can't test enough people or we don't have the capacity to take care of folks, then we're going to abide by whatever the public health guidelines say. So I know that's not the answer people want. People want to know the date. When are we coming back to campus? When are we coming back for sure? And it really depends on our public health authority and our ability to take care of people in our community. So that's the best answer I can give you right now. We would like to come back as soon as possible, as soon as it's safe to come back. Laura, our student enrolled in the MOT program, has another question. She says, is it safe to say that we're not coming back to campus on May 24th? Yeah, it appears likely that we would not be coming back on the 24th. And I'm going to ask Dr. Patchett to work with our faculty that are responsible for the MOT program. And it might be that we need to notify our Masters of Occupational Therapy students with more notice that for sure they won't be coming back on certain dates, and that the next possible date that might be available would be a certain date. So I'll ask Dr. Patchett to work with our department head in OT and our faculty to come up with a communication strategy, because I see the challenge here for Laura and the rest of the MOT students. They have to book flights, they've got to book hotels, and whenever we wait too long, it makes that more expensive and more challenging for our students. So we will do a better job of communicating to you when the first likely time that MOT students would come back to campus, Laura. Dr. Patchett, would you like to add anything else to that? Do you think that's a reasonable request?
I agree, that's reasonable. Thank you.
Okay. Laura, does that answer your question?
As another student in the MOT program, that definitely helps me. And being in Texas, I would have to go into an area that has a lot of COVID-19 cases just to fly to North Carolina. So I would appreciate knowing it much in advance so I can be very careful in how I book my flights and that type of thing.
Okay.
And yes, that answered my question. Thank you.
Okay, thank you guys. I want to read a comment from Caitlin. She said she doesn't have a question. She just wanted to let us know that the faculty, that everyone's efforts have been greatly appreciated. Thanks for that feedback, Caitlin. We are trying very hard to be student-centered and trying to be empathetic and understanding of how difficult it is for you. So thanks for that feedback and the compliment. We have a question from Alexis. She said, for an upcoming nursing summer class, the syllabus is worded in the sense that we will be attending clinicals this summer. So is it okay to believe that this is true or not? So we want to get you into clinicals as soon as possible. And we have to wait for the clinical preceptors and the fieldwork locations, the hospitals, the doctor's offices, and so on, to allow us to do that. So I think that the faculty are probably creating these syllabi with the hope and expectation that at some point over the summer, you will be getting back into the clinicals. But if you're not able to, because the facilities are still restricting access to students, our faculty will come up with reasonable accommodations or will delay your clinical experiences until it is safe to do so. Okay. Good question, Alexis. Thank you for that. Is there anybody else that has questions, comments, feedback? While there's a break in the questions, let me pose a similar question that I posed to our faculty and staff on Friday. How does this plan make you feel? Does it make you feel a little bit less anxious and nervous knowing that we're working on these specific details? Does it give you any comfort that, you know, we're thinking about these things? Anybody?
Hi, I don't know if you can hear me. This is Magdalena. Hi, everybody. No vision, good for you. You are doing great. I think it's great because, you know, we could have easily stopped every program and keep going. So let's focus on what is good. And, you know, I'm calling myself antique student. I believe that we already touching any kind of subject in this college. We're making obligation for responsibility for our surrounding, for our patients, their family. And you know what? This is the best training for telehealth. And I think Cabarrus did great.
Yeah, you bring up a good point. I mean, here in the healthcare field, they've been talking about telehealth and being able to use that for years. And now, because of COVID-19, we were forced into it a little bit more quickly than we were expecting. And we've had a lot of our students that have been getting their clinical experiences by telehealth. I just met this morning with the chair of our OTA program, and she was telling me how some of her students have been getting very valuable experience using telemedicine. So you bring up a good point, Magdalena. Thank you.
So if you're talking about our Miss Nancy, oh my goodness, this is the best person you can ever get. Never let her retire, never. I'm putting that as an option.
Okay, thank you.
Yeah, and I just want to second what Magdalena said. Was very, very impressed with the phasing plan and particularly the screening. And I feel like our school is at a slight advantage just because we're connected to Atrium for testing, and I know they stay up to date. And then the fact that you stay in contact with the Health Alliance certainly makes me feel safer going in, especially since some of our students are more at risk to be exposed due to the nature of healthcare.
Great. Thanks for the feedback, Amy.
Mm-hmm.
All right, let me ask another question that I posed to our faculty and staff on Friday. What's left that's unresolved? What questions that we still have unanswered that are making you most anxious? What's the burning question that you want us to get answered before we open campus back up and you come back to campus?
I have a question for me more so, I'm sure everybody else as well, but I work in a SNF, and as you see, they're getting undertaken by this virus. If in case a building is hit with a SNF, do you want us to just stay away, like consider ourselves high risk, or do we come if we feel good? What would that look like? Especially for nurses as well. I'm sure some of them might work in a SNF. Yeah,
so I think we will come up with guidelines of what that's going to look like. Obviously, we're going to take safety first. So if anyone, whether they work in healthcare or they're just studying healthcare, feels like they've been exposed or likely to been exposed, we will ask them to stay home. Now we do have the appropriate. We're in very close touch with the folks at the hospital, and we feel that the screening procedure, the social distancing, and the requiring masks is the appropriate thing to do. That's what they're doing at the hospital. But if there's anyone that feels like they've been exposed, we will encourage them to stay home and to learn through our virtual campus.
Thank you.
Sure. There's a couple questions that have been posed in the group chat. Let me see if I can get caught up here. If we have concerns and questions that relate to us as an individual, can we schedule with you for a personal conference? Yeah, either, what I might do is ask our Dean of Student Affairs and Enrollment Management, Dean Corsello, to field those individual meetings or someone. But yes, we will set up an opportunity for students to meet individually if they wanted to do so and had specific questions that related to them. Absolutely. Sarah has a question. It says, with volunteer hour requirements will volunteer hour requirements continue to accumulate if we are able to meet them again in the fall semester? So since I'm new to Cabarrus, this is my 7th week, I'm not familiar with the volunteer hour requirements. So I might need to learn more about how many hours those are required per semester. And we may need to make some modifications to that. That's something that we probably have to take back and consider. Dr. Patchett, can you help me out here since I'm unfamiliar with this requirement?
Sure. So some of the alternatives that we're looking at right now is providing some virtual opportunities. But again, as Dr. Cruickshank pointed out, we've not completely got a plan together for that yet. So if you'll just be patient with us, that's one of the things we're continuing to examine.
Okay. Thank you. Looks like Sandy has a question. Sandy or Sandra?
Yes, sir.
Sorry.
Concerning the volunteer hours, we got an email that if we weren't able to do it this semester in the fall, it will be accumulated. So we will do 10 hours instead of 5 hours for the fall if you're unable to do it. So my question is about, now that this COVID-19 is going on with the facilities that we are supposed to do the volunteer hours, if we are able to do it in the fall, I just wanted to know the preventive measures that will be taken for students if they are supposed to go out to do those volunteer hours with the companies.
Yeah, so I think with respect to volunteer hours in general, as Dr. Patchett just said, I think we need to do a little bit more work on that. We would probably make sure that you're doing your volunteer hours at organizations that have the appropriate safety precautions in place, where they're screening folks, they're requiring social distancing and other things. So we would not want our students in harm's way in any manner. As Dr. Patchett said, we might enable or permit some virtual volunteer opportunities, but we'll take that back and process that a little bit deeper and better. Thank you for bringing that up, both students who talked about volunteer hours. That's something that we got to work through as well.
Thank you.
We have another question that's been posed to us in the chat, and I think it's from Casey. And Casey asked, in regards to skills labs in the program, such as nursing, will these be given virtually as well? Additionally, how will it work if we missed a skills lab from the previous semester due to COVID? So if you missed a skills lab due to COVID, you should be able to obtain that skills lab in the summer semester. Just like when we talked before about labs and clinicals, you paid for them already. And if you were not able to participate because of COVID, then you will be able to participate without paying for it in the summer. Some of the skills labs may be able to be given virtually. That's a discipline by discipline decision. Some of our disciplines might be able to accommodate a virtual skills checkoff, where others might require you to come in and do it in person. So if you have specific questions about your discipline, the best thing to do would be to pose that to your faculty members or your department chair, because that decision will be left up to each individual department to how to handle that. Okay? Good question though, Casey, thank you. Other questions that folks may have? What are we missing? What besides the student volunteer hours that we haven't contemplated yet, is there anything else that we're missing and haven't thought of with respect to coming back to campus? All right. Well, it sounds like we've exhausted all of our questions. We have about I don't remember if we scheduled this meeting for 90 minutes or 60 minutes, but it's only 4:25. So if there's more questions that folks want to ask about anything about COVID-19 or anything else, this is a great opportunity for you to pose any questions you may have.
For the screening process, will that take place prior to the initial first class, or will it be the same day?
So screening will happen every day.
Okay.
So every day you come to class or labs, there will be screening, which brings up a good point, Robin. One of the things that we're all going to have to do is we're all going to have to change our daily routines, our daily behaviors. So for example, if you typically would come to class 5 or 10 minutes before class started, when we're doing COVID-19 screening, we're going to need more time for that. So you're probably going to have to come to campus 25 or 20 minutes before your classes start, to give you the time to go through screening, to get to the elevator and get up to your classroom. So, and we will communicate that to all of you and remind you, but everything we do is going to change. You know, when the stores open back up and the sun's shining, it's 80 degrees and you want to get an ice cream cone, it's going to take you longer because of social distancing. Just like it's taken longer now for us to go to the grocery store or do other things. Good question though, Robin. We will do screening every day.
Okay, thank you.
Yep. There's a question Caitlin asked, could we come up with a student screening process that we could get community service hours for? So if Caitlin is looking for the opportunity to participate in the screening process and get some of those community service hours, that's something we can look at. It'd be a good learning experience for students to be standing beside the screeners or helping to, you know, distribute materials or take temperatures. Yeah, I think that's something we could look at. Good question, Caitlin. Anything else anyone would like to ask or learn more about? Alexis has a question, looks like related to the CARES Act. What is the relevancy of comparing CARES Act applications to financial aid applications when financial aid hardships have been caused to COVID? So the CARES Act has some specific requirements they're not all favorable. We're not really happy with all these requirements. So students, for example, they have to be enrolled in the spring semester to receive the CARES Act funding. Some online programs are excluded from CARES Act funding. And in order to get CARES Act funding, students have to demonstrate that their hardship was directly related to the COVID-19 crisis. So actually with financial hardships that are processed by the financial aid office, they don't have the same restrictions as CARES Act funding. So you may wish to look at, okay, I've applied for the CARES Act funding and I've applied through the application process. I also might want to help the financial aid team know that I've got a special circumstance or a financial hardship that I would like consideration on, because the criteria aren't the same. There are differences. So where we might not be able to help you with the CARES Act, we may be able to help you with some special circumstance through a financial hardship application. Good question, Alexis. Thank you for that. Anybody else have questions? Allison's raising her hand. I think you're still on mute there, Allison.
Yeah, sorry. I know that Cabarrus College incorporates a lot of atrium policies and procedures into their curriculum. I'm asking this question on a twofold process. Does the school have access to quality of care changes that Atrium is implementing due to these extreme circumstances within the hospitals? I'm asking as a student and learning these changes, but also as a family member who I have a loved one in Atrium at the moment, and we've seen a lot of breakdown. I didn't know if they are really focusing on implementing changes to help catch a lot of this and how we can apply it as students as well. Okay, great. Let me do my best to answer that question and interpret what I think I heard you say. So firstly, do we have access to some of the resources with Atrium, and do we follow some of the same policies and procedures? And I think the second question is, what can we learn from it? So we do get access to all of the changes in the standards of care, and we get daily updates, multiple updates. I think I get 5 emails a day from different folks about changes with PPE, changes with screening procedures, changes with personnel policies. So we are blessed. We're getting very frequent updates. Let me remind you that this is a once in 100-year pandemic. This is a very challenging situation, and our healthcare providers, our folks that are providing care in the hospitals, they're people too, and they are fearful. They've got families. There's been a lot of healthcare providers that have
been that contracted COVID and have gotten sick and died from it. So this is a very, very stressful and challenging time. And our hospital personnel are doing the very best they can to communicate. And there are times though where the communication breaks down, where one person might interpret a policy a certain way, another person might not have all the information and makes a decision that was not the right decision. And so what we're seeing, Dr. Patchett and I participate every morning at 11 o'clock on a call with the crisis team at the hospital. And every day they're making policy changes and updates and communicating about recent changes. So I'm sorry that your family has experienced some less than positive healthcare or some miscommunication in a setting, but I can assure you that there's lots of communication going on, and they're I think doing a fine job of trying to keep both the healthcare providers and us here at Cabarrus informed and in the loop. Did I answer your question, Allison?
Yes, thank you.
And by the way, folks, you know, we will get through this. This is going to be challenging. We might suffer through this for 6 months. It might be 2 years. We will get through this. But for you folks who are in healthcare programs and you're preparing to be a nurse or an occupational therapist or a surge tech, this is really invaluable experience that you're getting. And if you're unfortunate enough to face this again at some point in your career, whether it be 5 or 10 or 20 years down the road, you will be able to reflect on these experiences and be able to have some, you know, heads up on how to handle these things. So I know that we're all stressing to try to get through day to day, but look at the bright side. You're getting some really good experience that is real life. And, you know, you guys are going to be put in clinical settings that you're training for. You all signed up for this field of work voluntarily. This is a calling you had. This is what your blessings led you towards. Well, you're getting it, folks. You're getting it. And you're getting some great experience. So that's my 2 cents. All right, other questions, concerns, comments, feedback? Anything else you want to talk about today?
I just wanted to say thank you, that I appreciate all of the faculty and staff's understanding for different individual circumstances. I appreciate the consideration of time frame and partial reimbursement. I also think that our college has done a phenomenal job and has been extremely sympathetic where they did not have to. So I'm very proud that we have handled it so well.
Well, thanks so much, Robin. We appreciate that. Magdalena posed a question. Besides Facebook, do we have another platform we can post questions or simply message to students? Positive, just pick me up, chat as a tribe of Cabarrus College. We can set that up if there's an interest in having a weekly, just a social hour, a coffee shop chat. We can set up a Zoom meeting whenever you guys want. So if you guys just want to get on and talk to each other and check in with your friends and see how everyone's doing and socialize, we can make that happen. Absolutely. So I'd encourage our student affairs team to ask our students if it's something they'd like to do, and we can definitely set that up and use our resources to set up something like that. Professor Houston has also notified me that it's going to be part of the self-care toolkit that our ad hoc work group is working on and implementing. So we will have something along those lines when we go to phase 1 and when we finalize this plan. All right, folks, I think we're running out of questions, and we've been at this now for just over an hour. I want to wrap up by saying thank you so much to everyone for your participation. You had some great questions. You identified a couple things that we had not thought of yet, especially as it relates to the volunteer hours. And you brought up these good issues about communicating with the Master of Occupational Therapy students. So we thank you for that. We appreciate the feedback. And please stay tuned for another update to this plan and for information about when we will move to phase 1. Thanks so much. We appreciate you guys and have a great day. Bye-bye.
Thank you.
Bye, thank you.